So welcome back to the next session, which is an introduction to the joint action towards a European health data space, TEHDAS. And it's my pleasure to introduce Saara Malkamäki, and who is going to give us an overview. Just a bit of background, Saara works as a specialist. I'm not sure whether that's what a specialist means there. It sounds like an assassin. In Sitra, the Finnish Innovation Fund, a future-orientated public think, do, and connect tank. Really like that phrase. Saara helps to build a fair data economy and promotes the use of health data in Finland and Europe. Saara's goal is to make data move across organizations and across national borders to create common rules and solutions and for fair value-added data use. Over the years, Saara has been advancing health and social care innovations and setting up a one-stop shop for Finnish well-being data. Her focus is on health data ecosystems and business models. Creating a better future is what Saara is passionate about. So over to you, Saara. Thank you.
Thank you so much, Glenn. Let me just start by sharing my screen, and hopefully everything works well after a while. Okay. All right, I hope you can see my presentation on a full mode, not my speaker slides. Just let me know if there's some troubles. Thank you for the introduction, Glenn. It's a pleasure to be here, and I'm going to give you an overview of the TEHDAS Joint Action, which is the joint action towards the European health data space. And of course, I'm going to talk about the work so far and results to date. So as Glenn said, my name is Saara, and it's nice to meet you all. Okay, first, let's have a look at the European health data space as a whole and what it consists of. And then I can kind of outline how TEHDAS aligns to this picture. So basically, the European health data space consists of two parts: the primary use of health data, which focuses on the better healthcare, and the secondary use of health data, which focuses on creating better policymaking, research, and innovation to Europe. And on the green side, you can see four pillars that it focuses on. The first one is about legislative and non-legislative measures on, for example, governance, interoperability, and citizens' rights. And the second one focuses on data quality, so about these verification projects and other mechanisms, creating that to Europe. And verification means here is findable, accessible, interoperable, and reusable. The third one is divided actually in two parts. So the infrastructure part, the first one is focusing on the primary use of health data. So it aims to create the cross-border infrastructure for health data exchange. And the second part is focuses on the secondary use of health data. So creating this EU-wide infrastructure for secondary uses. And last but not least, the capacity building, which is in the focus. So kind of trainings, cross-border cooperation, and best practices through different funding mechanisms. And if we look at now how TEHDAS aligns to this picture, I put it here like this, so you can see that it really focuses on the secondary use of health data, so creating the better policymaking, research, and innovation. And just for you to notice that it also excludes the capacity building, but of course includes these three first pillars. And on the infrastructure side, we focus on the secondary use. To put it in a nutshell, TEHDAS really helps both the member states and the Commission in developing and promoting concepts for sharing of data in secondary use purposes and for the benefit of citizens' health, public health, as well as health research and innovation in Europe. So that is a kind of nutshell, put it in a way, what we do. But of course, we want to go a bit deep diver. And I love this picture because it actually gives you a clear view of what TEHDAS is and what it is not. So I like to show this when I do presentations about TEHDAS. TEHDAS really is a preparatory body, so not a legislative or executive body. It really does not define the European health data space, but we create proposals, options, and solutions for exchanging health data between different European countries. So keep that in mind. We don't define it, but we create proposals and options. The joint action is a project between 25 European countries, from which 21 are EU member states, so only 6 EU member states are missing, and 4 non-EU member states, and those are UK, Norway, Serbia, and Moldova. It is really co-funded by the EU Health Programme with 2.5 million euros, and the rest comes from the member states. So it's co-funded with the European Commission and then member states. It really does not build these kind of working IT solutions nor pilot use cases. So that's a way to do it differently in these different programs later on that comes to the European health data space. It's not part of the Horizon Europe funding program either, but it has a clear scope and defined deliverables and a timeline. And our project really started on 1st of February this year, and it will still last for the next 2 years. The work is really divided into 8 different work packages, which kind of sums up nicely what the project aims for. So I will give you an introduction, but also explain a bit more what's going on in these work packages. The first 3 ones are really simple, so I'm not going to use much time for this. The first one coordinates the project, the second one communicates the results and deliverables, and the third one evaluates the project results. So it's all about the project management. But now, if we go further to the work packages 4 to 8, I will have a bit more content to give you about, and hopefully that you find interesting. The first work package, which is the work package 4, engages really in dialogue with different stakeholders to identify their needs and expectations for the European health data space and on economic sustainability. So it's important that we build on top of what has been already developed in different projects and initiatives before joint action. And this is something that we really pay attention to. So include different stakeholders within our project and learn from them and not reinvent the wheel again. And as an example, I would like to give you a call that we did when we first started our project. So we started in February, and on March 1st, I think we opened up this stakeholder open call for all equally to apply to be our partners and to be in our work package advisory groups in this project. And it was really a nice way to open up our stakeholder engagement part. And actually we get almost 200 applications from 27 countries, and we could actually take in the 26 countries. So only 1 country was kind of left out from these different groups. And that shows that we wanted to make this commitment early on and get the stakeholders highly involved. And we got amazing group of people and experts involved now, which is the success factor. And why I bring this up is that it's not always common to do that. So I think we were not so sure, maybe not the first ones, but one of the first ones who have done it this way. So I'm really proud of it as well. But what else will we do in this work package 4 is that we organize these project and policy forums. And so far we have had 2 project forums, and the last one was held late October, so 29th of October this year. And it gathered more than 10 European health data specialists in this project forum from more than 50 projects and initiatives. So that also tells that we have more than 50 projects overall Europe taking part, and we can learn from each other and also engage in the TEHDAS project. And also the policy forum is a very important channel for us, but it is a closed forum that way. So it's very much invited, only the ministries of Europe are invited, and 3 different ministries are specially focused and invited here. So the ministries of health, economy, and research in the European countries. And they are invited to take part and discuss with us how we should take things further and propose new legislations to the European health data space and actions. Actually, the second policy forum will also take place next week. So we are up and running, and that way we get new input from the ministries. What's happening also is that during the next 12 months, we will organize these country visits to 12 countries, in which each country's health information and health data management system will be mapped. So we will have 3-day interview interviews going on to these countries. And of course, we will do a literature review as well and compare these countries between each other and learn from those. And just to mention, the 12 countries are Ireland, Netherlands, Sweden, Germany, Belgium, Slovenia, Hungary, Finland, Denmark, Estonia, Portugal, and Czech Republic. So maybe you can kind of point out that, oh, we're in or we're not in, but don't worry if you're not in. And the first visit is in December 2021, so already next month, and it's happening in Denmark. And last in this work package, we have the economic sustainability part, and the first results that comes out in January this year examines the future European health data space funding needs and sources regarding the secondary use of health data in the light of the previous EU projects and funding mechanisms, both at the European and national level. This result will not be published as it is, but it's more of an integral result. So if you're interested in this, I'm happy to let you know more about it, but we will gather first more information and then publish results later on our website. Okay, moving on to the fifth work package, which develops options for governance models for the exchange of health data between European countries and at EU level. In here, we have already published 3 results that can be found on our TEHDAS website. So go to tehdas.eu, and those were published in June, July, and September this year. And at the moment, the work package is really drafting options for actual alternatives on the governance model for the European health data space. So it's an interesting ongoing work, and the work is led by the Netherlands. The sixth work package really develops this guidance on ensuring data quality and interoperability. So data quality is in the center, and comparable high quality health data for research and innovation, of course, is at the core of this work package. And the first results of this work package has been published also on our website in this month. And this result proposes ways to regulate data quality in the European health data space. So if you're interested in data quality issues, go to check that out. And just to mention that there's always an easy read article of the publication or the result. So you can have a one-pager to read what is it all about and then deep dive to the results if you want. And the seventh work package focuses then on technical interoperability, and it creates a model for shared European data infrastructures across the European Union. And here we have already 2 results published on the TEHDAS website this September and this month. And the first report provides this overview of the current technical solutions in different data hubs. And data hubs can refer to these national data hubs like FinData, for example. I'm from Finland, so I can say FinData or French Health Data Hub or something else as well. And the second report describes the most important services for secondary use and identifies user journey for cross-border health data sharing. So this is important, that it's about taking into consideration the user, like a researcher, for example, and how we can then build the technical interoperability and how they can get the consent and all that into consideration. And last, the citizen work package, which is very important. So we seek to gain a better understanding here of citizens' attitudes toward sharing their health data. And we also identify ways to inform people and raise awareness of the benefits of the secondary use of health data. Data altruism is a definition that is very center of this work package as well. And so far, actually, we have done these literature reviews on data altruism and citizen engagement together with stakeholder interviews. And first results on the data altruism definitions and use cases and consent and accessibility was already published on the website in September. And what's happening next is that early next month, so 6th of December, this online e-consultation, which is dedicated to the citizens to better understand their perceptions and preferences and expectations, will be launched. And it will be open for 4 months, so until early April. And the focus is on 3 countries, so France, Belgium, and the UK. Unfortunately, we cannot take all countries into considerations, but the goal of this e-consultation is really to increase the awareness of the health data reuse and enable citizens to really learn more, express their opinion, and exchange with others as well. And there's a new website called ourhealthydata.eu that this e-consultation is conducted.
Saara, 1 minute. Yeah.
Yeah, I'm done almost. So this is my last slide. Thank you. And check out the website TEHDAS.eu. And if you want to know more, sign up for our newsletter, follow us on Twitter, and you can find all the results that I was describing here from our website. So please go ahead and look at those, and happy to discuss more. And over to you, Bledi.
So Saara, thank you. That was a tour de force in terms of an overview of TEHDAS and the program. I'm really grateful. We need to move on, but if there's any questions that come through, we'll drop them to you and we'll give answers in an email or we'll post them tomorrow. So thank you very much. And without further ado, I'm going to move us to the break. So if people can be back promptly at 15:45 CET for the next panel. Thank you very much.